Welcome, everyone. We're very glad that you're all here. The webinar is Beyond Red Flags, Rethinking Healthcare's Response to Trafficking. We're looking to move on from our checkboxes to really help, offer resources and help survivors and victims in that moment of need.
So I think the important thing as we're getting started, it's the important theme of this webinar we like to think about is unlearning. And I think this is part of why we're offering this, because many of us have ideas about trafficking and the circumstances that might lead someone to be trafficked. But before we actually jump right into the seminar, I really want to kind of share a story. So the picture's a little bit foggy. I apologize, but I want to introduce you to someone who was very impactful to me. Her name is Felicia, and she's allowed us to share this story. But she's 35 years old. She's had 6 pregnancies, 2 children. She's 18 weeks pregnant, and she's experiencing homelessness living under a bridge. And I met Felicia while I was on street rounds providing family care to unhoused persons. So Felicia left her boyfriend and the apartment that was in her name because she was being forced to turn tricks to pay for his crack cocaine habit. And so little by little, cocaine became a way that she coped with her feelings of worthlessness while she was on dates. And she needed help reconnecting with an OB because she had missed the last 2 appointments. And she was feeling a lot of shame for losing custody of her twins and for missing the appointments for this pregnancy. So at the end of this appointment, Felicia shared that she was also turning tricks for food and to pay for the cocaine that she was now dependent on. And she shared at the end of our visit, like, I really want to keep this baby, Nani. Is there any help for me? And so in one visit, Felicia helped me to unlearn 4 really big ideas that I still carry with me. One is, why do women become unhoused? And she shared something about the domestic violence intersectionality that was super important, that I really understood that. She also shared why someone might use crack cocaine. For her, it was the way she could cope just to get through with the trauma that she was enduring every day. She also shared, which is something I want us healthcare providers to think about, but she shared why someone might miss a doctor's appointment. She literally was living day to day and moment to moment. So that to her, survival was the thing that was more important than making a doctor's appointment, understandably. And the fourth thing she shared with me that really helped me to unlearn is why someone might engage in commercial sex. And so, despite Felicia's unimaginable barriers of homelessness and substance use and commercial sex, Felicia shares hope. And we're going to come back to Felicia later on in this presentation, but the whole idea of unlearning some of the concepts that we have is going to be super important this evening. So I hope you'll join me in the unlearning and the art of it. So we've got a great group of folks here, and so I'd like to introduce you, and you're going to get to hear more from this power team for sure. So we've got. I'll actually, Stacy, I'm jumping all over you. Stacy, you jump on in and do our great introductions.
You got it. So this evening we have the gift of 3 lived experience experts as well as 2 healthcare professionals, myself and Nani. Our lived experience experts will introduce themselves more thoroughly before the panel discussion, but for now, please say hi or wave hi when I introduce your name. We have Gina Cavallo from the New Jersey Coalition Against Human Trafficking. We have Fanis Lepenga from the U.S. Advisory Council on Human Trafficking. We have Christian Eduardo from the U.S. Council on Human Trafficking, and he does a lot of great work with the coalition. My name is Stacy Kalman. I'm a nurse and I'm with the New Jersey Coalition Against Human Trafficking. And then we have Nani Cuadrado, who's a PA. She's with Heal Trafficking. So we're all here with you today.
So this is our agenda. Again, welcome everyone. We've got a great evening ahead of us and one that's sure to keep you engaged. And so for the first 30 minutes, we're going to review these 4 bullet points that you see here. I'm not gonna read them to you, but Stacy and I are going to share why healthcare and other anti-trafficking professionals are moving away from the red flags as identifiers for human trafficking. This is a super important shift that's intentional, and its focus is really on whole person care, which we'll get to hear a lot more about from our esteemed panel. And really, that the recognition that trafficking intersects with forms of violence and social issues. So, this will be super important as we kind of pull that through this webinar this evening. And so, following our brief interactive training, we're going to have a valuable panel discussion with our lived experience experts. And so, that make the best use of our time together, we're going to ask you to drop questions in the, I guess we said Q&A before, but it might be easier for us to kind of monitor on the chat itself, and feel free to interact with each other in that space as well. And we're going to allow time at the end of the session to address these questions.
So we're here for a call to action because we believe that when education is followed by action, change can happen. By the end of this session, we challenge you to think about one action that you're going to take as a result of the information that you've heard from this webinar. So we hope that we help you add something valuable to your practice.
Absolutely. I love that, Stacy. And some of you may already be familiar with human trafficking, and while others are encountering this content for the first time. So even for those of us who have experience, it's important to recognize that we all carry assumptions and gaps in understanding. So this is normal and expected. So in this next exercise about unlearning, what might be accurate or not accurate, and also the relearning so that we can deepen our understanding of human trafficking and what it is and what it isn't.
So we're going to give you a thought exercise. If you guys can just kind of imagine for a second, we're going to start the training by inviting you to join us in a quick thought exercise. When you hear human trafficking, who comes to mind? Picture the first person that you think of. Do they have a certain race or ethnicity, a certain gender maybe? Are they experiencing labor trafficking or sex trafficking? Hold on to that image of who comes to mind because we're going to come back to that and we'll expand on this throughout the training.
I'm going to give folks a second to think, like who they might picture when they think of someone experiencing trafficking. So I'm not going to ask you to shout this out louder, and I don't need you to drop it in the chat at this point, but what did that person look like? Did this person look like Marcus, who was labor trafficked while working construction? And if people like Marcus didn't come to mind, I'd love you to think about why that might be. We're constantly bombarded with media images and stories, and these shape our perceptions. And as we'll learn, trafficking is far more diverse than what makes the headlines.
So the 4 main reasons to shift away from red flags, they have to do with the thought exercise that we just did, and it may help us to understand assumptions that we ourselves have in our understanding of human trafficking. The shift away from red flags as identifiers of human trafficking is to improve our response to incidences of trafficking. While the term red flags is not uncommon when it comes to human trafficking identification, and over time it became apparent that it was rooted in inaccurate assumptions that sometimes resulted in misidentification, poverty shaming, discrimination, and scrutinization of immigration status.
Yeah, you're right, Stacy. Unfortunately, the use of red flags also failed in relationship building, as noted in number 2. As providers, we were not asking the right questions, and we really missed opportunities to build relationships with our patients. And as noted in 3, red flags commonly saw people as a checklist. And Stacy talked about this in the beginning, that rather than seeing someone as a whole person, it became a list of boxes that we checked off. And when a person is a checklist, all of their needs may not be identified. And so later on in this session, we're going to share a framework that's going to help you to build relationships and with persons who've experienced violence. And while unintentional, finally, what we've seen is red flag approach can also be re-traumatizing. And we're going to hear that from our folks with lived experience after this session.
So, human trafficking can happen to anyone. So, we want you all to open up your minds and really look at this. I saw a couple comments come up in the chat where a few people had said it can happen to anyone. And I love that. I love that there's that understanding. So, thinking back to our thought exercise with Marcus, we understand that human trafficking can affect many different people. This leads us to our next question of who experiences human trafficking. It can happen to anyone, regardless of age, sex, nationality, gender, or any other factors. While that's technically true, the reality is that there are certain groups that are more at risk to experience human trafficking, and Nani will expand on this next.
Yeah, so I mean, as Stacy shared, we know that certain groups are more vulnerable to trafficking, and this isn't a coincidence. We think about generational trauma, historic oppression, discrimination, other societal inequities. They create vulnerabilities across communities, and it's not weakness, it's actually system failures. And so I just kind of want to remind us, as we're thinking about that, traffickers know how to target folks who've experienced depression. And if they know how to target, then we as a community and as healthcare also can learn better how to identify those types of vulnerable populations. And so in the chat, this is the interactive part that we'd love you guys to participate with us. Please share some populations who may be vulnerable to trafficking. We'd love to get your interaction as you join us. Yes, excellent. LGBTQ plus, migrants, BIPOC, immigrants. Yes.
Mhm.
Nicely done. You guys are on fire. Runaways. Yes. Yes. Thank you, Stephen. Victims of sexual abuse, violence, homelessness. Absolutely. You guys are doing great. Who says 7 in the evening is difficult to attend a webinar? Nicely done. Yes. Thank you, everyone. Thanks for participating. I know it's sometimes hard at the end of the day to put that another cap on. But thank you. Yeah, so I think now as you're thinking about some of these ideas, I think it's going to help us move forward as we think about where folks are now showing up for support. Thank you for participating, everyone. Appreciate it.
So, survivors can come through many doors and they can often access services for reasons unrelated to trafficking or trauma. So, we need to really open up our mind and keep this in mind. These are some places that we found where survivors have come to, for services. It's important for us to remember they may not disclose their history or even recognize their experience as exploitation. It's very important for us to remember they may not self identify as a victim or survivor of human trafficking. So we need to keep that in mind when we're, delivering treatment and maybe change our practice a little bit.
Yeah, well said. Well said, Stacy. So this is Heal Trafficking's Why, and hopefully something that really kind of gives pause for us as folks that want to care for persons that are experiencing trafficking. So there is a study that we've cited here, and we actually gave you a range because 68 to 88% of folks are actually receiving care from a healthcare provider while they're being trafficked, and the provider doesn't know. And so this is a powerful statistic. I need more water. And it reminds us why it's so important as healthcare providers that we're educated about trafficking and we're part of the solution. We've got a really great opportunity. They're seeking our support, and hopefully we're that trusted provider. So we're in a super unique position that we can actually respond as that trusted caregiver. So this is definitely our why.
That's a great point, Nani. If we just take the extra second to show people compassion and kindness, we can become that trusted person, that safe person for these victims and survivors in the moment of care, at that point of contact. So, this is the power of PAIR, and this is from Heal Trafficking, where Nani's group is from. And we love this tool. It's evidence-based. We talk about it during our presentations as well. It's adapted from what we've learned from the domestic violence field. Developed in collaboration with survivors, Common Spirit Health, Heal Trafficking, and Pacific Survivors Center, PAIR can help us implement the trauma informed principles that we've been talking about. It's an approach designed to create empowering conditions when engaging with individuals who may have experienced trafficking. It can also be applied to other forms of violence as well. So, this is a great tool to use, and it's something great that you can all add into your practice.
Yeah, feel free to use that QR code if you'd like to learn a little bit more or download the PAIR tool. So, as we stated in the beginning, this is an intentional shift from red flags that we're really moving to. And it's kind of exciting because no matter which human trafficking screening tool that your hospital system utilizes, it's crucial to develop a relationship with your patient first. And I mean, it makes sense, but that this pair tool will help to get you started. So remember Felicia, my pregnant, rough sleeping patient who was living under the bridge. She's giving us permission to utilize her case in this to show you how the pair tool can be used to begin these trauma-informed conversations. And we're going to jump right into that.
So, with each letter of the acronym PAIR, we're applying to Felicia's case and giving you sample verbiage so that you can use the PAIR tool in private in your practice. So the P is for providing privacy. And what that might look like is us just saying, Felicia, part of your routine care is for us to speak with every patient alone for a few minutes. It makes us sure we're giving the best care. Is it okay to have your friend step away for a few minutes? We'll let her know when she can come back.
What I love that you did there, Stacy, is you gave her a choice. You actually asked her permission for her friend to step away, and you also kept her informed. I think that was really nicely done. The next letter in pair is educate. And when applying that to Felicia's case, this is something I think we talk about education, but we're not just talking about just kind of a generic education like you should stop smoking. We're actually talking about educating our patients regarding something that we're concerned about. So it's very targeted. So in this case, we're trying to normalize the sharing of information, but I'm also wanting to make sure she knows what I'm concerned about for her. So I might say, thank you, Felicia, for trusting me with your story because she shared a lot. I want you to know that my role is to support you and to help you stay safe. Would it be okay with if I spoke with your OB and help you to navigate your pregnancy at 18 weeks? Also, if you're interested in a shelter, we can share some information about what your options are. And so again, for me, I think what we're trying to do, if you'll note, is that we're asking permission. We're not rolling over her, but asking permission to reach out to her OB. So we're giving her that choice to say, no, I don't want it, or yes, I do. And then we're also educating her. I'm worried about her being under the bridge. So I'm educating her and just saying, look, I'd love to give you some options. And I'm saying you shouldn't be down here. You need to go to a shelter. I'm actually trying to share the options and leave that open for her.
I love that example that you gave, Nani, because, like Nani said, not only are we walking alongside of her, we're giving her choices and we're giving her resources. So we need to remember the reason that we ask questions is not for patients to disclose their trauma, but for them to have a better understanding of how we, as providers, can support them. Here's an example of how you might ask a question to better understand what resources to provide. You might say, Felicia, I ask all patients questions about their work, home life, stress, and safety. You can share as much as you're comfortable with. These questions are to help me understand how to support your health. We're doing that in a non judgmental, I'm walking alongside of you, and you're creating that safe space with compassion and not non judgment.
I love that. I love that. And you're just normalizing. I ask everybody these questions, so that's awesome. Um, this is the hardest one, I think. This is challenging because it's our nature to help, and it can be heartbreaking to recognize that someone's experiencing trafficking or they've disclosed it, but they're not quite ready to leave their situation. And in this case, Felicia shared that she was ready to receive support from our team, but she wasn't ready yet to address the trafficking experiences. And we consider that still a win. Slowly building that relationship with Felicia is what's most important. And so I want to remind us to celebrate these small wins. In this case, we're thrilled that you like her support, connecting you back to OB, to your OB. Like, let's concentrate on getting you healthy to have this baby. If you ever want to address the relationship with your boyfriend, we're always here for you and would be happy to provide additional resources should you need them. So again, let's celebrate, even though maybe she's not ready to address the trafficking. That's okay. We want to get her back to that OB. So again, respect her choices.
And that's perfect. The last part of that statement, like Nani said, we're leaving that door open for future interaction. We're just letting her know we're here if you need us. And the last R is for respond. When a person who's experiencing trafficking is ready to receive support, we should be ready to offer a warm handoff. What does that look like? Well, it does mean your institution may have to do some homework to understand what the resources are available in your community. Here's one example of what you might say if your patient is ready to leave his or her trafficking situation. I can't wait for you to meet our patient advocate and whoever that might be. Would it be okay if I get her on the phone so the two of you can connect and arrange a time to connect?
I like that. It's not just like giving a slip of paper, right, Stacy? You're actually trying to make that connection and you're affirming the person that they'll be connecting with. I love that. Yeah, that's way different than just here's your piece of paper and here's some resources. Love that. And so this is another challenge that Stacy and I want to have you remember, because success is not about how many survivors you identify. Rather than focusing on red flags, we're really focusing on creating those open doors and making every interaction safe and welcoming, even if there's no disclosure. So by building trust and providing resources and supporting survivors where they're at when they're ready, uh, that open door will stay open. And I think that's important. And it's so important to heal that we've actually updated our logo to reflect this mission, that H that you see, that's the H for heal, is a person opening the door towards healing, hope, and trauma-informed care. So I'm going to share some good news. As Stacey and I were talking about, should we share what happened? But yes, we're going to share what happened because I think it's the hope that we all need. So that this is the update. So Felicia became an important educator for me. She, as I'm an ally in the anti-trafficking space, she became probably my most important teacher. She graduated from the Mommy and Me substance use program. She was able to take Genesis, her daughter, home after giving birth. And Felicia also was able to reconcile with her mother, who she'd been estranged from. And she actually also began gradually building relationships with her twins, who were being cared for by their father. And so she's now just concentrating all of her energies on being the best mom that she can for Genesis.
I love that story, and I'm glad it all came together. And Nani really helped to create that open door. And that's really, really important. And that's the point of why we're doing what we're doing here today. We want to encourage all of you to meet people where they are and leave the door open for more narrative when people are ready to leave their situation, whether it's trafficking or any other kind of trauma. Um, So as we mentioned at the beginning of this presentation, we believe that when education is followed by action, then things can actually change. After you've heard from our lived experience experts, we challenge you to think about one action that you're going to take as a result of what you've heard during this webinar. As a reminder, please drop your questions in the Zoom, in the chat box. That's fine. And after the panel discussion, we'll have time to answer some questions. And now I'd like to welcome back Gina, Phanis, and Christian. Gina will be our moderator for this discussion, so we'd like to welcome them back.
Welcome back, folks. Floor is yours.
Thank you. Thank you both. This was excellent. I really appreciate your insight and all the work you put into this. So I want to move this along to our panelists now. My name is Gina Cavallo. For those who don't know me, I am survivor leader consultant with the New Jersey Coalition Against Human Trafficking. I am also co-chair of the New Jersey American Academy of Pediatrics Task Force Against Human Trafficking, and I'm appointed to the commission for the state of New Jersey. Amongst other things, I do a lot of training throughout the states and working along survivors. And one of the unique things about our organization is that we don't use a few survivors, we use many survivors, because all survivors have different lived experiences. And the thing with this crime is that it's not a cookie cutter crime. It comes in many forms, discriminates against no one. If you ask, what are the signs? What are the red flags? What does a trafficker look like? What does a buyer look like? What do victims look like? They can look like you. They could look like me. There's no certain, this doesn't fit in a shoebox. So moving on with this, I'm really happy to be here because this is something I've been talking about for many years, about let's get away from the check boxes. Let's get away from the red flags. Even though we know it's important, law enforcement has their responsibility, and so does healthcare. And unfortunately, healthcare has that responsibility of filling in the check boxes to be able to diagnose and to understand what's going on when someone comes in for an emergency or whatever the need may be. And I think sometimes we lose sight of that compassion, and that we are going into these situations scared, with a lot of fear, a lot of shame, a lot of guilt, not trusting people. And, sometimes it could feel like a checkbox that I know that I didn't matter, and that you just want information. And what compounds it more is not being able to self-identify. So many victims of trafficking, abuse, and violence, as I said, are unable to self-identify or safely disclose what they are experiencing. Yet systems often rely on red flags, checklists, and questioning, placing the burden and disclosure on those least able to carry it. This survivor-informed webinar shifts the focus from identification to safety and what that looks like. Through lived experience and survivor perspective, participants will explore what helps people feel safer in moments of care and interaction, even when disclosure never happens. The conversation centers on language, environment, and responses that reduce harm, builds trust, and opens pathways to support. I'd like to pass this on to my colleagues to introduce themselves before we get started. Christian Eduardo, and then you can pass it on to Phanis. Thank you.
Yes, perfect. Thank you, everyone, for being tonight with us. I saw that you were on fire on the chat, and I really love that. I love also seeing people from all across the country. So this is exciting because as we saw, 66 to 88% of survivors interact with healthcare. So I think that it's very, very important to move a little bit away from red flags, because that can be confusing, and that I think that a lot of times that create this environment of what we should do, and really focus on, as Gina was saying, on the safety of survivors, people who are being impacted by human trafficking. So my name is Cristian Eduardo. I'm originally from Mexico. I'm a survivor of sex and labor trafficking. I was trafficked outside of Mexico and in the United States, outside of the United States. I'm the chair of the United States Advisory Council on Human Trafficking. I'm one of the board members of the New Jersey Coalition Against Human Trafficking. And I do a lot of policy advocacy, trainings, public speaking, and really working with impacted communities and survivors to educate nonprofits, healthcare, law enforcement, politicians, Congress people, senators about the realities of human trafficking. And I'm very happy to be with all of you today. So I'm going to pass the mic to Fainest.
Hi, my name is Panelists, and I am a member of US Advisory Council. Just a disclaimer, I am not presenting the US Advisory Council today, but instead I am speaking today as a concerned citizen. I am also a former advisory council to the Human Trafficking board member of former board member of Survivor Alliance. I'm so happy to be here.
Thank you so much, Finest. Thank you, Christian. I'm so honored to sit alongside of you both, and it's just always like coming back home, being with you. So let's get started. I want to bring this question to Finest. I'll start with you. Can you share what it was like for you to access healthcare during the time you were being trafficked, your experience? Or were there times that you felt that you needed to avoid it when you needed it the most?
Thank you for asking that question. Yeah, so when I was trafficked, I interacted both with him, I mean, the institution, especially health care, like one of them. When I was in traffic, both when I was trafficked as well as after. So when I was trafficked, my first visit to the medical facility actually was with my trafficker. I wasn't, first of all, I wasn't allowed to access the healthcare, but I was having like a teeth problem all the time when I was in traffic because I wasn't able to I have a dental care like teeth brush, toothpaste like that. So I end up losing my teeth. It's all in the cavity. So one day my trafficker drove me in the middle of the city in the national capital of United States, Washington, D.C. I didn't know where I was. And I find myself to emergency room. She just pointed out, but I didn't know where to go. So I showed up in emergency room, and I wasn't identified as a victim. Unfortunately, it wasn't only one time. I visited like one of the most great hospital in Washington, D.C., but they never identified me. I did not have no ID. I did not have no money, but I visited over and over. I remember one time they even turned me away because I didn't have no money to pay. But one of those visits, I remember I was surrounded with like so many doctors because again, I visited so many times and it was on all the time was like my teeth, swollen in the face. And this time, the doctors were getting concerned, and I wasn't speaking English that time. My English was so very limited. So luckily, there was one doctor, and this doctor, dentist was from my own country, Malawi, who was who was speaking my own tongue language. And they brought that doctor, in, and he was like, oh, these people surrounding are like worried about you. You are too young and you are losing teeth. What is going on? Like la la la. So I was able to share with him that I didn't know, first of all, what human trafficking is, but I was able to share enough, be able to speaking the same language that I was being abused by my trafficker. But like this doctor, instead of help me, he sent me back to my trafficker. So I was trapped. That was it. And I also then visited, like after I escaped, I also visited, like, I mean, I ended up in the hospital. I was in the hospital more than an entire month, okay? 1.5 months. The whole time I was in the hospital, I wasn't identified as a victim of human trafficking. They wasn't able to provide like the service that I needed, like social services, mental health. I was malnourished because I wasn't fed. So nobody asked me. I was so aggressive. Not only I was putting in this like special diet where they check my tray every day, make sure I was getting that, because when the doctor come check my tray, they were getting angry, yelling at the doctors and nurses who give me the trays because I was almost die. What I needed, I wish somebody could see me. I was so aggressive. I was crying every time when I say, like, when you get up, where you gonna go? I'm gonna go back, like mentioning. I was crying all the time, but nobody like see me. Like I wasn't, even though I wasn't able to communicate, I wasn't speaking English, but I wish somebody could like it. I mean, first of all, we have medicals, they are frontliners. When you're working in this field, don't just rely people who you interact with, communicate with you in English. Sometimes, as Nina said, that sometimes we don't even know that we are victim of human trafficking. That was my case. Sometimes it's your duty to consider body languages, even though I wasn't talking, but I have like signs. I was malnourished. I was so aggressive. I was crying. Nobody asked me. I did not have ID. I didn't know the address. All those kind of things. Unfortunately, that was my case. And instead of help me with the, social service again that I needed, mental health, and after like staying 1.5 months in the hospital, they end up transporting me somewhere else all the way in Baltimore. I was trapped like a few minutes away from Washington, D.C. here. But I was dropped like in Baltimore, Maryland. And when I was over there, I was also picked up with a doctor who worked also in this capital city, who also then exploited me around. Yeah. I was dropped in homeless shelter, but homeless shelter is only, you can only be there during the night, during the day, they let you out. And I didn't know anybody. So just wandering in the street of Baltimore where I was picked up by a doctor who exploited me.
We cannot hear you. You're muted. Yes.
Thank you so much for sharing that, Finest. It had to be so frightening with what you were already experiencing and then having to experience that. Was there anyone that made you feel safe through your experience?
Yes. So there are two, actually maybe three. So I'll share the first one. The first one is when I was trafficked. My trafficker took me to the clinic when I was sick again. No. Took me to the clinic one time with them. So they spoke on my behalf. And the doctor gave me prescription. I went back. Then I was sick again. Then there was a family member who visited at the house. And this family member was concerned. It was like, Finest, I was taking medication. She looked on my medication. She saw the information, and before I know it, what I remember was she was talking to on the phone. Then she told me that I need to go to the doctor. She wrote down a direction on the paper with me, and I took a bus. And I was just showing the driver the paper where I was going, and that read me to the place where I went with my trafficker. And that was the clinic. And when I entered that doctor's office this time, the doctor was like, Finest, you look like a skeleton, you're gonna die. Are these people abusing you? I say, yes. and I shared what was happening with him, and he subscribed medication again, and I left, and this doctor turned his back. So he did the right thing. He knows he want to step in to help me, but guess what? He turned his back, and he grabbed the phone and reported to my trafficker, and that puts me in danger.
Sure, sure.
But another, I have a positive experience that happened to me. I was in the hospital getting treatment for mental health in the Cuadrado. That was after I was trafficked. And when I was discharged, my social worker came and picked me up. And when they're having meeting with the doctor to discharge me, they gave me a referral to see a therapist. And when I overheard the name of the therapist, I cry, I scream. And the doctor asked me, like, why? I said, I don't want to go to that therapy, because they said, no, you've been seeing this therapy for so long, so you need to go. But I tried to explain to them, they did not buying it. They said, because this therapy knows you, it's good that you start with this one. If you want to change, you can do it later. Fine. I started going to that therapy after I was discharged. But every time when I go to that therapy, my situation wasn't getting better. This therapy was judging me, blaming what happened to me, every single thing ever happened to me. And I keep every time telling my case manager, I said, I don't want to go. So she could not, but one day she said, fine, this time I'm going to go with you. She went with me 2 times to visit. And she requested she want to be in the section with me. She observed, she said, fine, we are out. You're not coming back here. She removed me, and I started seeing like different therapy. And that was it. And she apologized to me that I am sorry. I wish I could listen to you sooner enough. And another positive thing that happened to me, I was also end up in ER, and this time it was good experience. The nurses started coming in, and in the past, the experience I have, when you go to the hospital, you have nurses, one will come and check you, like blood pressure, will go ask you question, and then another will come in, will ask you the same information over and over, like just get like it traumatizing you over and over. So this time was different. I had the first person who came in, the second person was like, oh, well, there's another person who's coming, but I'm gonna just brief this person so that we don't have to repeat this again, because it's hard for you. So
Yeah.
On top of that, this nurse that time asked me if they can have somebody who is also living experience to come and sit with me. Because again, I wasn't opening up, because again, like we come from trust is one thing about us. We don't trust people like very easily. So this nurse was able to contact my social worker, and my social worker was able to bring like a lived experience survivor, Shamila Mackenzie. Shout out to Shamila Mackenzie. She came and joined me while I was in ER, like where I was staying like from 5 a.m. to 2 a.m. before they sent me in the room, give me a bed. So that was very helpful. So I thought like that was trauma informed. So yeah, that's what was supposed to.
Thank you. Thank you so much. I'm just going to pause you there so I can, I'd like to hear from Christian. But it's so, when we relive that and talk about it, it really gives us better clarity of what fails in our systems and what works, and I think it goes back to the check boxes, right? Where, we're human beings, that have come in here, and we're not only bleeding on the outside sometimes, but we're bleeding on the inside, and you can't see that. And that we need to feel that compassion, that compassion can go a long way. Christian, I would love to hear from you if you can build on that and share with us some of your experiences, what you felt worked and may not have worked.
Yes, no, definitely. For me, it's very interesting to hear other survivors' experiences, because as a male survivor, and I need to give a little bit of context. I was trafficked as an adult, and I experienced trafficking in different countries. And when I was thinking, I actually interact with healthcare clinics, doctors, social workers through my first trafficking experience, through my second trafficking experience, and after my trafficking experience. And I think that one main thing that I remember is that when I was already here in the United States, my traffickers were the one who took me to a clinic. And I remember that I was in the clinic and I was afraid, to be honest. I was like, probably they are paying, probably they know all the people in the clinic. So I need to be very careful about what am I saying. And I remember that I was feeling bad. I was feeling like having a cold. And I went over there, but it was like a very, very bad cold. And so after weeks of telling them, like, I need to go to a doctor, I'm feeling bad, they were like, well, okay. And my traffickers were all the time with me in public transportation, in public spaces. So, and they would act like we were friends, Sometimes one of my traffickers would act like if we were boyfriends. So for the outside eyes, especially for the healthcare, I remember that I would arrive to the clinic and the reception, everybody was like, oh, hi. And they would say hi to him. And I will get more afraid because I was like, oh, like does everybody know what's happening? And the same as famous, I didn't know that I was being trafficked, but I knew that there was something wrong. But seeing that he knew all the stuff, like create a wall of hypervigilance. And I was like, even if they ask me, I cannot disclose because probably they're gonna tell him. I remember that the nurse checked their vitals and everything, and my trafficker was standing on my side. And how are you feeling? Like, and they asked you like, are you feeling good? And you're feeling good? And I was like, yes. And also I think that one of the barriers it was that I wasn't as fluent in English as I am now. So and my trafficker would answer, and I would get scared because my trafficker was answering. So that would hint me that I needed to behave more, like that I needed to hide it more. And at the same time, in my mind, I was really hoping, like, isn't it weird that he is speaking from me? Like, there was one part of me that it was like, isn't it weird that he's answering? Isn't it weird that we are right together? That he say my name? That he registered me? That he's coming for my vitals? Isn't it? Bring it. But I think that it's very. I have seen that because I am a male, because I was an adult when I was being trafficked, and also because I wasn't in distress, I wasn't crying, I wasn't screaming, I wasn't. If you would see me, like probably not the same, probably like I was like younger, to be honest, when that happened, but I wouldn't exhibit like overtly signs of trauma. So I think that everybody was assuming like, oh, they're boyfriends or they are family or they are friends and they are supporting one each other. One of the big things that I remember is that in one of the visits, I got diagnosed living with HIV, and this was the result of my trafficking experience. So I didn't know what to do. I really wanted to tell the staff like, very likely is because this is happening. Where am I living? The people that are living with me are like making me engage in sexual acts. Like I don't have a place to live. I don't have family. I don't have friends. Like I don't have money. They are also not only doing this sexual engagement with them and other people, but also like they are forcing me to work. So if somebody would have like just asked me like, what's happening? Where are you living? I would have been like, yes, please. And one other thing that I want to highlight is that I'm a gay man. I remember that they asked me in several intakes, even after being diagnosed living with HIV, they asked me, have you ever exchanged money for something of value? And I remember that that my trafficker was there, and I thought like, yes, like and I answered yes. I remember that my trafficker, I didn't see him. I saw him from the rear of my eye, and I saw how he got angry, how he was like, why are you answering this? the doctor just follow up. Like there was no more. Like, and through my advocacy, I have seen that this is very common, that there's this myth or this idea that men and boys, we engage in commercial sex because we experience pleasure. And it is the same, this stereotype about like gay men that is like, or LGBTQ plus individuals that is like, oh, but you love sex. That the only part of your experience is like, you love sex. So you cannot be trafficked. And so I think that there were a lot of opportunities for healthcare workers to intervene, to ask beyond. I think that the signs weren't there, but I think that the behavior, and if they would have focused on my safety and what was happening in my inner circle or in the place that I was living, they would have detected human trafficking before. And my trafficking experience here in the United States went for over like 8 months, and probably from those 8 months, my trafficker was taking me to the doctor like probably like 6 out of those 8 months. So there was a lot of opportunities for healthcare to ask to really see me as a person. I think that a lot of times they were just seeing me as a test, as someone that it was coming, someone else that they knew, they were bringing it. So they never follow up about like, and they never saw me beyond that. They never saw me as a full human being. They never saw, or they never thought that there could be like something happening. So I think that that's the special piece about me that I would like everyone to really understand.
Christian, thank you so much. Looking back, do you recall anyone that responded to what you were going through, that responded to your trauma or recognized your trauma, that was able to help you in a way that was different than your experiences?
Yeah, it's interesting. I think that at least in the healthcare, they go, once I was diagnosed living with HIV, their priority, or what do they define safety for me, it was me not dealing with the consequences of HIV. So safety for them was like giving me treatment, making sure that I was taking my pills, but really nobody saw beyond that. They never asked like why this happened, or why are you dealing with STIs, like you were recently diagnosed. Like they I think that once they had a diagnosis of something, they just took that, and that was my whole persona became an HIV diagnosis. And even if I was trying to do something else, they never did something else. So I think that for the protocols and everything, I was safe already because I was taking my medication. So I would say that I think that that's why we need to move beyond flags, because it's usually not a flag. Like if someone is taking their medication, there's an assumption that, oh, they are doing good. And I don't know, like I remember that when I was taking my medication every day, for me it was, and I remember that it was a blue pill. And I remember that I was thinking, the pill is blue as the sky, but I cannot see the sky, not every day, and I'm trapped here, and I cannot tell anyone, like, and nobody know what is happening to me. So it was interesting because the pill, I don't know, somehow became like kind of a hope that somebody at the clinic would like go beyond like their protocols, or just like think that male can also be victimized.
I think it's so interesting what you shared, that really resonated with me when you shared about like you end up being judged, the stigmas, right? So by your diagnosis, and I think so many do that even outside of healthcare, where we are judged, right? And it could be a diagnosis. I remember many times I was in the hospital and my diagnosis was, they admit you in the psychiatric ward, and you stand online like one over the cuckoo's nest, that movie, and you just wait for your medication, and you're diagnosed because you're suicidal or you're depressed. and you just go by that diagnosis, and it's like really harmful, because it's like you can't get to the core of what's going on, because self-identification is really, really hard. And when you're coming in with all that shame and fear, and you had people with you that compounded it even more, where it made it difficult for you to talk. Do you think that had you not had these people with you, or your traffickers with you, do you think you would have been able to talk more free? Or do you think that if the healthcare providers were able to self-identify, were able to identify what was going on with you, do you think you would have been able to articulate what was going on with you?
Yes, because I think that I was hinting it to my primary doctor. I remember that there was one time that I saw my primary doctor, and there was one of those weird times that my trafficker didn't enter, or they were asking him something, and my doctor came and he was like, "Oh, come." And I was with him alone, and I say, "Am I gonna be okay?" And I remember that he looked at me, and I was really like hoping that he will ask, like, "Why are you saying that?" Or like, but the assumption that it was only because of HIV, he didn't question more, and he said like, "Everything is gonna be fine." And in that moment, I think that unintentionally, it make true what my traffickers were telling me, like, nobody's gonna believe you, nobody's gonna help you, even if you try, like, nobody's gonna pay attention to you. So when I say, like, if I do you think that I'm gonna be okay, and you say everything is gonna be okay, I was like, it's true. What my traffickers are saying is true. Like, even if I try to ask for support, it's better if I don't disclose, because everybody knows them, and everybody's telling me that everything is gonna be all right. So probably whatever I am experiencing, it is my fault.
Yes.
So I think that unintentionally, the whole like healthcare system was like really like just making through what the coercive part that my traffickers were using on me.
Wow, that's so interesting, and it's so true. I really appreciate you sharing that with us. I'm going to come back to you, Christian. Finest, I'd like to ask you, could you share any experiences where anyone was able to recognize your trauma and help you in a way that they were able to respond to what you were going through?
Unfortunately, be honest, no. So going back to the hospital in Washington DC, I did say, like, this doctor actually, when I shared, he told me, his point I will never forget it. Like, he told me that I should be just very grateful that I'm here in America. There's so many young people like me back home in Africa are dying to come to America. I should be grateful that I have, like, I can see the light here. I came from the village. I can see the light in, white people. So, and when I was also in the hospital for 1.5 months, unfortunately, talking about the trauma informed, now that, like, well, I told myself through watching cartoon after I escaped my trafficker, nobody like rescue me. I hate the word rescue, because I want to punch that person who's saying, because not every single survivor were able to get help to, free their traffickers. Some of us, we had to take, like, we have to take a stand, a risk to, to run away, like my case. So when I was at the hospital, unfortunately, my trafficker showed up in the room with the, wasn't announced. Now I look back, think about, like, HIPAA, where I was like HIPAA, like, I thought, like, when you're in the hospital, when you have a visitor, they will announce, "Oh, Miss Finance, we have a visitor. Mr. Christian is like, is it okay if you can let him in?" I would say yes or no. No, I wasn't given that opportunity. This time in the hospital and announced, The same trafficker who threatened me that when I run away, I will find me. I thought he would find me because she was a diplomat, cannot get in trouble, have immunity. And when he showed up in the room, I was like, oh my gosh, she was right. This is what she was talking about. She had, so I was scared for my life. So even though I ran away, I wasn't safe. And then like, because also I was aggressive, the doctors, instead of like understand me, they injected me, okay, to shut me up. And they injected me medication that it break me out. I had allergy and it was burning. I break up my whole body and I was screaming. And they put me in the room that was dim. They turn off the light, put them dim, and leave me there. So that was like a punishment for me. That's what I got from health care field. And again, I told myself English through watching cartoon. Looking back right now, every time when I have an opportunity, like educating, like health care, it's like, yes, this is my revenge to me. Because again, for me, every institution failed me, from law enforcement, lawyers, airlines, so communities. So yeah, so.
And thank you. And all those that you mentioned, Finest, are all those that we are taught to trust, right? We're taught to trust law enforcement. We're taught to trust healthcare providers. And we get reharmed. I was speaking with someone earlier, and she said she never disclosed. She never disclosed because we're not believed or we're reshamed. And it's like, people question. We all have the biases, these stigmas that have to be just removed, because we can't do any of this. We can't do any work in a way that's going to be effective, that's going to help other human beings, if we don't remove and not judge others. And I also know when someone is speaking in a condescending way, where, they're looking down at you, and that just reinforces everything that's going on already. I want to share one little snippet that I learned in healthcare as a child, and it pretty much set the path for me of what I learned. And I hope that healthcare can really pay attention to this, because it matters. And it resonated with me, Christian, when you were talking about when your traffickers were in the room. But I remember at the age of 8, 9 years old, and my mother was in a room, and someone harmed me. Someone harmed me so badly that I needed stitches. And I go to the emergency room with my mother, and they asked my mother what happened. And my mother told them that I did it. I hurt myself. And that's not what happened. Someone was chasing me to hurt me, and they pushed the glass in because they were determined to get me. And the glass shattered all over me, and I ended up in the hospital getting stitches. And when I leaned over to my mom as a child, and I'll never forget this, it'll always stay with me. And I said to her, I said, that's not what happened. And she said to me, she said, shh, quiet. We learned silence. We learned silence because we're not going to be believed. And because those that should be accountable, they're being protected. We see it happening today. And so with that being said, I remember leaning over to my mom and I said, why did he hurt me? Because I could feel the pain. I could feel the emotional pain, the mental pain. And now I'm feeling the physical pain as I'm getting stitches. And she said to me, oh, honey, he didn't hurt you. He loves you. So I think that the mixed messages we get can really, just mixed the way we think and the way we see things. And I really believe that healthcare can be a pivotal part. And I do feel that they're coming a long way to see us, to hear us, and to try to do things better.
Definitely, Gina, if I may, like it resonates with me a lot because while being trafficked, I think that a lot of times there's this ambivalence that is like your trafficker is harming you and you don't have maybe the language to do it, but also your trafficker is taking care of you if you have access to the hospital, or like your trafficker is making sure that you go from where you're staying to the hospital and way back. So is this mixed messages as you're saying, like, okay, so my trafficker, well, in that moment it wasn't my trafficker, it was like, does this person care about me? It seems that it cares about me. And also I think that a lot of times like I think that it's so important for healthcare workers to understand coercion, because even if you will have asked me like openly, like, oh, is he abusing you, I will be like, I actually don't know. Like he thinks that we are partners, but I don't think that we are partners. But he brings me to the doctor, so I don't know if he cares about me. I don't know if I should be grateful, and also like at the same time I think that it's hard to put the pieces together, like that the person that is taking care of you is the person who is harming you, and because you cannot see it, the picture as a whole, you don't see the magnitude of the harm that is causing on you. A lot of times I think that they take care of the physical pain, they take care of STIs, they take care of broken bones, or like you have the opportunity to heal that, but the psychological harm, there's no language for us to be like, well, actually, like I'm feeling super bad. I want to kill myself. Like I remember that one other barrier that I was facing is that I was always worried, like if I bring more stuff, will the clinic will charge more money? Because my trafficker was saying that they were paying. So I was like, if I receive more support of another person come, they are gonna charge them more, and they are gonna know that even if I by myself, like that we did something else, that something else is happening. So I think that it's so important for anyone who is going to a clinic, everyone who is working, like make the patient know their rights and that they have how they can access healthcare, because I think that would be so helpful for me. My traffickers were always telling me, if you try to leave, if you try to say whatever, like we are the ones providing you with your medication. So and by that time I thought that I was gonna die from HIV. So so it was like their main tool, and I was like, well, I cannot do anything. Like,
yeah, Christian, I'm so glad you brought that up, because we do get mixed messages, right? And along with the mixed messages, we're trying to put a language to something that we don't even understand, right, Finest? It's difficult to get that language right, you know. And when we're getting mixed messages from people who are supposed to care about us, who are supposed to take care of us, I believe that so much with our vulnerabilities comes at a very young age too, by the seeds that are planted in us, because we all live out by what we learn. I'd like to move on to the next question, and it's going to be about, I want to talk more about resources, and maybe I could start with you, Finest, if you could share with us about were any resources provided to you in the sense of any resources at all, housing, legal aid, shelters, anything at all that you found that were helpful? And if not, what would you think that could have been helpful, that could have made a difference for you?
Thank you. Yeah. So unfortunately, they did not provide like any services to me, apart from just being in the hospital and show up in the emergency room. And I unfortunately, I experienced homelessness 3 times, and including just being in the street, picking up in the trash, and just to survive. But though I wish they could, if they could ask me, they could offer me what I needed that time. I needed safety. I needed a shelter. I needed clothes. I needed food, and then I needed social services. Like, also I needed mental health services, like where I need to study to heal, to understand what happened to me and begin to heal. But none of those was provided to me. And also, then I just want to also mention that on top of that, when even when they do provide, like if they do at all, the medical here who are listening to me or who will listen to us later, every victim's needs is different. My needs is somebody's need. On top, it's somebody's. It's not the same thing. Like a Christian who needed, like maybe, well, I needed a Vasco, I needed housing, or I needed food. Christian needed like something else, and then also, not all trafficking victims' experience are the same. So don't compare the situation. Don't compare us. We are different. We come from different situation background, like as you can see, the way Christian shared his experience, mine is completely opposite. I was trapped for 3 years, and he was a victim of like child, both labor and sex. So yeah, so you have to consider, just don't think like one cup fit all. No.
Fineness, I so appreciate myself that you are sharing that, because I hear too many times people on both sides who are comparing, and we should never compare stories. We should never speak for other survivors either. You know, your story was not my story. My story was not your story, and it's not for me to tell. So I think we need to understand that more. The audience needs to understand that more, that if we had 30 survivors on this call right now, we would all have a different lived experience. And it's just like when we talk about it too, we can't talk about that abduction rarely happens. I hear that so much. We shouldn't even be saying that. If you weren't abducted, don't even talk about it unless you have proven statistics, because this crime comes in many forms and it discriminates against no one. And I think it's just really harmful. So I do appreciate that you shared that, Fineness. That's really important that we take that away.
Yeah, and I want to add more thing. And like when we after when we left so consider when we left our situation, it doesn't end up there. We need more services. And Christian shared her his medical experience. We developed, my case, I developed a lot of medical conditions that never been treated. I have disability, both invisible and visible disabilities that like started when I was trafficked, it continuous and it debilitated. So we still need the service. Sometimes we think like, okay, we give you this, it's over, but like in reality, we still need the services.
Yes. I have a question for you. I'm sorry, Finest, if I interrupted, but I have a question for you. What was the turning point for you, that the services that did help you?
The service that helped me, it was, wait, I just want to mention one more thing.
Okay.
When I left it, like I move on, think like I move on, I left, right? Guess what? The emergency that I was visiting, this emergency I was visiting, the bills, my traffic wasn't paying for my bills. I wasn't getting paid. I was paying 0 to less than 30 cents an hour. So when I left my trafficker, the bills, they found me. I don't know in America how they found you when you move. They've located me where I was. They sent me bills. Okay. They even sent me to collectors. A lot of bills. And like healthcare in America is not cheap. Okay.
Yeah.
So
Yeah.
even like free, like pretty much I wasn't free to move on. So what's my question now? Sorry.
Thank you. Christian, could you share about what helped you as far as any services, resources, shelters, legal center?
Yes. So after some time, I think that it was after I escaped my trafficking experience, and I still was going to the same clinic because I didn't know how to access another clinic or how to access medical services. After that, the same clinic that I was going where I was being trafficked, they have an LGBTQ plus program. So they were having like workshops and still stuff like that. And I was afraid because my trafficker was also part of the community, but I was like, okay, I need food. And I remember that they were giving transportation and pizza or something like that. So I was like, okay, like I was experiencing homelessness too, and I was like, I need to find a way to move around the city, and also I need food, like that was appealing for me. So I went there, and they connect me. In New York City, we have something that they are called the Family Justice Centers. So any victim of gender-based violence can be referred there by a provider, or you can go by yourself. They do an intake and everything, and so the clinic referred me to Family Justice Center. At the beginning, it wasn't helpful because from the clinic they sent me with a caseworker. When I got my intake at the Family Justice Center, they were asking me more deep questions. How did you arrive here? Who are you living with? The kind of questions that I was expecting the clinic to ask me. And the reality is that I was still afraid of answering them because my social worker entered with me when they were doing the intake. And because it was coming from the same clinic where I was being trafficked, I was like, what if I say yes? And this person, because everybody knows my traffickers, now my trafficker is going to know, and my trafficker is going to find me. And what if, I don't know, what if he beats me? What if he kills me? What if he sends someone because he was stalking me after I escaped my trafficking situation. So I was very afraid. But within time, the person who did the intake, who ended up becoming my immigration lawyer, the person who really helped me understand my trafficking situation, one day, I think that she noticed that I was being nervous, or that I wasn't disclosing stuff, or that I was like acting weird. And she asked the social worker, can you stay outside? And I remember that the social worker from the clinic got angry because he was, oh, he's my client. Like, I'm always entering with him. Like, it's my duty. And the person who became a lawyer was like, well, yes, but I would like to discuss some things in private with him. And that was the entry point. And after that, I asked my lawyer, can I change clinic, like, without paying bills, without, like, because my trafficker was going to the same clinic, so I cannot continue going to the same clinic because I'm afraid every single time that I'm going, like, I'm looking if he's there, I'm looking if he's waiting for me, I'm looking if they are gonna tell him that I'm going. So I think that one of the most beneficial things that someone has ever done in service provider for me, it was, she said, yes, you can do it. And I think that she saw how hesitant I was. Like, I don't know how to. I think that my face was screaming, I don't know how to do it. She was like, do you want me to help you? Do you feel comfortable if I help you? And I was like, yes, please. I remember that she took the phone, she made a phone call, and she was like, you just need to go to this address, and that's all. And I was like, oh my God, that was super easy. And I was like, but I think that a lot of times what I have seen is that even in the clinic, they were referring me to services, but I wasn't able to make a phone call. I wasn't able to send an email. I wasn't able to present just by myself. because I was afraid. I thought that my traffickers were all around the city. I thought that my traffickers knew all doctors, knew all clinics. So I was very afraid of going by myself. And it was like still this shame that I was like, oh, I'm living with HIV. They are gonna, even if I tell them what they were doing, they're gonna blame me because I'm an adult. So I have seen that they don't care. I have seen that they don't ask me anything. So I will say that that is one. And in the new clinic, actually, I remember so clearly that the first intake that my doctor did, he asked me, are you feeling safe where you are living? Who are you living with? Is where are you working? Are you getting paid? Is someone taking your money? Like, do you have enough food? And I was like, I remember that I told him, like, I wish somebody had asked me this 2 years ago. And he was like, "What? That's what everybody's supposed to do." And I was like, "They are not doing it." And I think that in that moment, it's when I felt safe and I started like really asking for support. I was like, so interesting that Phineas was mentioning the teeth. I, even while I was being trafficked, I was suffering from my wisdom teeth, and it was like something that I don't think it was important. I was so worried that the pain was like fine, and I started asking help. I remember that I asked, like, can I go to the dentist? How can I pay for all this? Like, and I start like really asking for support and be like, can I do this in the city? I don't know, can I get vitamins? Like, I'm feeling tired. And I start like seeing that, but it was after the doctor really asked about my safety, prioritize my needs. And before like diagnosing me or continue giving me medications, he saw me as a full human being. So that was totally the game changer for me.
I love that, how he saw you as a full human being.
Mhm.
That's pretty powerful. That's like transforms everything, right?
Yeah.
And you pretty much answered my next question. Like, what could healthcare do differently, for people who are experiencing trafficking? And, what you shared about the fear and shame is literally so crippling, right?
Yeah, I can start and Fitness can go after me. I will say that one of the big things that we were talking before about this ambivalent, like mixed messages, because of all the coercion, because all the fear that my traffickers were instilling on me, were putting on me, that everybody was against me, that nobody was gonna believe me. And I don't want to be mean towards anybody working in healthcare. I know that all of you are like working a lot, that it's very stressful, that a lot of times you have a lot of patience. But I remember that every time that I was feeling like I should share what's happening to me, a lot of times I would have like mean nurses that they were like, "Come on, get ready. I need to get blood of you." And I was like, "Oh no, trust." For me, through my eyes and through my experience, I was like, you know what? My trafficker treats me better. My like why would I ask? Why would I ask help to a nurse like that? And also even my doctor, I remember that he was like, "How are you doing? Are you taking your medication? Good. Like, do you need anything else?" Like, okay, bye. And I was like, what was that? I was like, I'm not a robot. Like, and I think that those relationships, those behaviors that they were like, he's fine, he's an adult, he's a male, he's not crying, like he's doing fine. Like, let's not waste our time. So they were just seeing me as a number of like patient. Like, I think that those really became barriers for me to reach out for help. So I really encourage. I know that there's a lot of that we put on healthcare workers, to be honest, but a lot of you can truly become the people that it's gonna hear us for the same time, that it can like give us back our humanity, to be honest, like, because our traffickers told us that we don't belong, that we don't deserve, and that we are not worthy of receiving services. So I will say that that's my first recommendation. The second is reviewing all your intakes. Make sure that live experience experts and tools like the peer tool are implemented not only in intakes, but really on trauma-informed approaches about your client, even if you client. I think that that's why it's so important, this webinar and the peer tool, because we need to move away from red flags. There's a lot of human trafficking survivors that can exhibit the red flags, but there's a lot of situations that, and I think that that's why it's so important not only have this understanding of what is human trafficking, but also how we individuals, survivors and victims, how do we react to trauma? Because I think that my reaction to trauma truly, it was funny. It wasn't like running, it wasn't like fighting, it wasn't really that. It was just, I just need to comply to continue alive. And the system, the healthcare system became like that. The healthcare system was like, if you comply, you're going to continue getting your medication. If you don't complain, you will continue seeing you. We won't charge you. Like, so I think that that's so important, like to really educate everyone. And my last call, I think that is boys and males can also be trafficked, even if we look good. I think that society has told us like to look always good. It's hard for male survivors. I think that not only society, but also we have internalized a lot of these stereotypes. If you were exploited or if you were abused, you are not strong enough. So it's hard. It's very hard to ask for support and to really recognize that. And we shouldn't rely on self-identification. Self-identification, it's very, very hard. I think that healthcare workers, you see a part of us that a lot of times not everybody see, because you see us in pain, you see us in despair, you see us with a lot of questions. I remember that when I was diagnosed with HIV, I had so many questions, and I was so ashamed, so in fear, and nobody saw me like that other than the nurse and the doctor. And I think that those were very specific moments where there could have been interventions and they could have like go beyond, like, why this is happening, like, do you need extra support, like, and also like set those expectations. Don't act like you are our savior. Don't act like you can get us housing, like a house forever. No, just be real. To be honest, these are my limitations. This is what I can support you with. Again, just see us as human beings. Even if we have gone to trauma, to human trafficking, like, we are still human beings. It's just that we have forgotten how we can see ourselves as human beings.
Christian, thank you so much. That was so impactful. And we say we don't speak for each other, but you really spoke a lot of words there that resonate with so many of us. And thank you so much. Fineness, would you like to add on to that?
Yeah, I just want to go back to the other question, like what helped me, because it wasn't just all like positive or this, but like at the end, what helped me that time, it was when I was trafficked, another lady saw what was happening and sneaked me out from like the house. I was trafficked by a diplomat and took me to this Castle of Maryland, where I met the lawyer and she explained what was happening to me. And then when I wonder after homelessness, I went back and she referred me to American law school. And it was there where I was connected with like lawyers and law school students, and then like Ayuda for my housing, Ayuda, and my first housing, and also then I was also in a Polaris project, transition housing, and that helped me with like social services. I was talking about case management, and yeah. So the community stepped in later at the end. What was the last question you was talking about?
Is there anything that you feel that the systems could have done differently for people that are trafficking, and for your own experience that you had shared?
Yes, I feel like even right now, I feel like the system could still, like, there's still a room, it's improvement. for improvement, because I still visited healthcare. I just came from the hospital, as I just said, I was admitted. So, I mean, I cannot distress how many times I've been this, like in medical field, like mentioning about, sharing about human trafficking. They say, oh, human trafficking, they're like, they don't know nothing about human trafficking. They get shocked. So I have to train them like at the point. So there's room for improvement. Something that could be done. I wish somebody could ask me. Could ask me what do I need, or what was wrong with me, instead of punishing when I was so aggressive. So don't judge the patient when they walk in your doors. Don't judge them. Take your time. Listen to them. And if they don't talk, or give them time, maybe they will open up to you. And if you suspect something, have somebody who is equipped to come and talk to that patient. Maybe opening up. Last but not least, believe survivors. Nothing about us without us. Thank you.
Thank you, Finest. I appreciate that so much. And I appreciate what you and Christian had shared about the rescuing. That really activates me when I hear that over and over. No one saves us. No one rescues us. And I think we really need to remove that. And how we're going to do that is through education. I also feel that, we carry around so much with the shame and the fear. And I know we talk about this a lot, but it's so true. Because how do we chisel through what's going on with us? How do we find the language with what's going on with us if people are going to sit there and they're going to judge us? And there's going to be the checklist. We're not a checklist. It made me feel like I was part of the system. It just made me feel like, and honestly, it made me feel like an object, that there was compassion missing. There was no connection, just being there, not understanding what was going on with me. All I knew is that everything about me was wrong, everything. But yet I'm supposed to be answering these 20, 30, 40 questions that I can't even answer myself, but I'm supposed to be answering with the bright lights over me. It would be like, when is the last time you ate, right? Because we're sleep deprived, we're food deprived, and when is the last time you slept? Are you cold? Do you need another blanket? Would you like another one of those turkey sandwiches in the hospital? To me, they were like a steak. When you haven't eaten, those turkey sandwiches are really good. And when they say that we have no more sandwiches on the floor, please find me one. Dim the lights. I may need to sleep for 10, 20 minutes. That would make a big difference. And as you both had said earlier, it's like, believe us, just treat us with some kindness and compassion. One of the things I did love about hospitals is when they said they were going to admit me. Many people don't like being admitted to the hospitals. I liked it because it made me feel safe. Even though they were treating me as my diagnosis, that's how I was being treated. No one was able to get to the core of what was happening to me. I was having difficulty getting to the core of what was happening in my life. But when I was hearing the crickets, the noises in the background about my discharge, they start planning your discharge when you're in the hospital. That's when I started getting anxiety again, because I knew I was going to be going back and what was going to be waiting for me. So I'd like to go once more before I close this portion of our program and see if Finest and Christian, if you have any final thoughts you want to leave with the audience.
I can go super quick. Sorry, everyone. Like my Zoom
No apologies.
outdated, and I was like, great, beautiful.
Okay.
I heard that you were sharing like how those sandwiches were like the best. To be honest, when I was in the clinic, also the pizza that they were giving, they were like just the best for me. I remember that I was like, oh my god, like this is food. Like I don't know who made this food. Like thank you, person who cooked this food. Like, I can feel the love, like even if it was real or not. But for me, like having warm food and able like to eat it, like it was just like. And I think that it's not only those ways to satisfy like physical needs, but also having that moment. I think that for me, it was not only the pizza. It was not only like that they were referring. I think that it was like me eating the pizza. It was like feeling safe in that moment. It was like, okay, at least for 1 minute, I feel safe. I feel okay.
Yes.
Like I know that while I'm eating like this slice of pizza, everything is gonna be okay. At least I don't need to be worrying at least for the whole 24/7. Like it was a break for me. And I think that psychologically that has a huge impact, because I think that those small moments, they were giving me like a lot of hope. I would say that Famous mentioned this, and I just want to highlight it. For human trafficking survivors, regardless if it's sex, labor, or both, our interactions with healthcare don't end when our trafficking situation ends. The reality is that I'm dealing with so many like issues. Like every day I wake up in the morning and I see the number of pills that I need to take because of all the consequences of trauma, all the consequences of like the abuse and all the intersections of it. The times that I didn't sleep, I suffer so many things. I take medication in the mornings and in the evenings, and a lot of times it's sad. It's sad for me to see like the pills and be like, why do I need to go through this? Like what did I do? Like was my mistake to trust people? But also seeing the pills, I don't know, seeing my medication, it reminds me that there's people in my clinic. There's reminding that there's nurses, doctors that care about me and that they want the best for me. And I think that my relationship with the healthcare, with nurses, doctors has really improved a lot. I love going to the doctor. I know that a lot of people don't. I love because they truly ask me, how are you doing? Like, does something hurts? Have you been sleeping well? And I'm like, no, I haven't been sleeping well. I feel bad. Like, and all these things. And they care. They ask me, okay, what do you need? Like, I have so many medical conditions that a lot of time my doctor is like, tell me what is happening this time. And I'm like, okay, let me take out my list. And he goes through my list and he listens to me. And he's like, a lot of times we don't, it's this intersection of like, there's nothing physical, but it can be trauma. Like, so let's refer you to a specialist. And I just want to make sure that everything is okay. I prefer you to ask me and spend this time with you to make sure that you are okay. And I think that that's one of the big pillars of me being stable. Like the healthcare part, my doctors, my nurses, my clinic taking care of me, like constantly checking on me if I'm taking my medication, if I have the right medication, if there's something new. There's always something new. I get checked like every 3-4 months. There's always something new. So, but it's very nice to be treated that way, like a human, and a reminder that any consequences of human trafficking, it's not your fault, and that you're worthy of getting treated, and that you are worthy of that someone care and have compassion and be kind towards you.
Thank you, Christian, for sharing that. Finest.
I think my last statement for me is the frontliners. When you identify like possible victims, I would say don't make a promise. Don't make a promise in a case like, oh, I'm gonna help you to do this, like, because you might promise somebody, if you're not meeting what you promised that person, you might end up just throw that person in the street. So don't make a promise when when you're trying to help somebody. When you say I'm gonna be there for you, I'm gonna help you, help that person, please. and follow up with that person.
Thank you, Finest. Thank you both. I want to thank our panelists, not just for what you shared, but for how you showed up today. These conversations, they aren't easy, and we know that, but they matter. And what we heard wasn't just about what's broken, it's about what's possible. It reminded us that safety isn't complicated, compassion isn't complicated, treating others with dignity and respect and humanity. It lives in the small moments, how we speak to one another, how we listen, and how we respond. This work isn't about having all the answers. It's about showing up differently because we're all different. We all have different lived experiences. But one thing we all have in common is that we're all human beings. And that's something every one of us can make a difference. Thank you all for being part of this conversation and for carrying it forward. And we're open now to turn this over for any Q&A.
Thank you all so much. I have to thank all of the lived experience experts for everything that they've shared. Your stories and your input on how we can help our patients is paramount to what we do as healthcare providers. So we can't thank you guys enough for sharing everything with us. And there's so many great tidbits and, just things that you gave us to think about. I'm at a loss for words, which those of you who know me know that's not usually a thing. So thank you all so much for everything that you've shared. We've got a couple questions. Nicole wrote, how do we truly teach healthcare providers to be more compassionate when healthcare providers are receiving pressure from their medical establishment to treat the condition and not the entire person? Nicole, that is a great question. And that is really a balance question. So I come from the background of the emergency room. So the ERs can be a crazy place, as most people know. And so do you, Gina, Phanis, or Christian have any answers as to how can you teach somebody to truly be compassionate, see the person as a whole person and not just treat the disorder or, the diagnosis?
I can share a little bit. I think that, and I see this across not only healthcare, but other industries. We don't address vicarious trauma between staff. We are not trauma informed from staff to staff. We are kind of good of being trauma informed from staff to patients, but we are not trauma informed from staff to staff. I think that it's so important to address vicarious trauma because you are not only, it's not about treating conditions. Like, you are not machines. When you are treating a condition, it's inevitable that you think about their family. If my patient is going to die, if my patient is going to take care of themselves, if it can get worse, like, what are the consequences of this? You need to balance. I'm always telling people this, like, if you would see all the side effects of my medications, like, it's insane. So doctors know that all these side effects, and they need to balance it. Like, okay, I care about my client, but if I balance the side effect versus the long-term care that I can give them a better life, I'm gonna deal with that. And we forget about that a lot of times. Also, one other thing is that even if we want to accept it or not, if we don't have a statistic, I don't think that we have a statistics on healthcare. We have a statistics on gender-based violence, domestic violence. In between your staff, there's also survivors, and they don't need to disclose for you to make a survivor informed environment for your staff, because the reality is that we don't know. Like, staff can also be victim survivors of different forms of gender-based violence. So it's not only about all the vicarious trauma from interactions with the client, with the patient, but also how it interacts with your current like trauma, your current situation. So I think that a lot of times we ask healthcares, just smile, like, regardless if you are like navigating financial or family or the death or someone. Like, I think that we need more protocols for that. What if not on how are we addressing when a patient dies? We want just our healthcare workers to be strong. Like, it was very painful. I remember for me, for COVID, like, I was like, healthcare workers are being stressed every single day with deaths. Like that's extremely painful, and we are not addressing it. We are like, they are the heroes, and it's like, well, yes, but that's not gonna heal. It's not gonna create a space for them to address the vicarious trauma. I think that is the same with human trafficking. I feel that especially for healthcare workers, knowing that probably is the first time that we are disclosing, I think there is this fear and this stress and this pressure, like, what is the right answer? What do I need? How can I do this so perfectly that I'm not harming my patient? And we need to address that. We need to have the support for those on ER, primary care doctors, like all doctors. I think that we need to remember that before being healthcare workers, you are also humans, and you are like you can be impacted also by trauma. So I would say, and that's that when you create that environment, it reflects on your patients. So I think that a lot of times your interaction that your staff is having with your patients, it's truly a reflection of how you are treating your staff.
And I want to piggyback off of you, Christian, here. I think it's really important. One of the senators recently shared, and I wholeheartedly believe in this, because you can't make someone have compassion. And if we don't heal what hurt us, we'll bleed on others who didn't cut us. And as you said, Christian, there are people out there that are surviving something. We're all surviving something, even if it's not trafficking. And there are many professionals who are survivors. They may not know it, or if they do know it, they may not want to talk about it because it could affect their job, it could break relationships, or the simple fact of what you shared of not being believed, the fear of not being believed. What you just shared, Terry, is so real. It's so real. And it can have such a detrimental impact on people not feeling encouraged, not feeling safe to step forward, to be believed. So I'm glad you brought that up as well, Terry. But I think it's so important that what you said, Christian, about there are professionals there that are survivors too that don't disclose. But it brings me back to what the senator said. And this senator said it with a lot of emotion. And she stood there and she told the audience, if you don't have compassion, you cannot do this work. Nevertheless, should you be in healthcare, do something that is going to require you not work with people, because we're only going to reharm each other. And that's not going to help the healing. It's not going to help our trauma.
That's a great point, Gina, and I love that you brought that up as well, Christian, that everybody is going through something. So even though we are healthcare providers, we're still people. We have lives outside of our jobs. But I agree with you, Gina. If you can't function in a place of compassion, it might be time to relook at your work situation, and that can be a hard pill to swallow. See what I did there? But I encourage all of you to, further your training as nurses. We have to get continuing ed credits. Look for continuing ed credits regarding trauma-informed care, trauma-informed practices. And that will just kind of reaffirm, maybe you've been doing this work for a long time and COVID hit all of us pretty hard. It will kind of reaffirm why we're doing this.
And I also want to add too, Stacy, that healthcare is under a lot of pressure. I mean, I grew up in healthcare. I'm still in healthcare, been an ombudsman for the state. And one of the things that healthcare is required to do, they have to put in so much time to have hands-on patients where you have patient time. How can you have quality time with getting to know your patients? If you are given 5 patients, 10 patients, 20 patients a shift, plus you have all this documentation to meet that's mandated by the state, and that documentation is also required to be done before your shift ends. So there are times that healthcare workers, they have compassion, but they lost it along the way because they're tired, they're drained, They're overworked. So maybe you do need to take some time off and just regroup and talk to someone too that's going to be that safe person for you too. Because I feel that healthcare providers also need safe people to talk to, where we're living in a society where there's stigmas everywhere. There's biases everywhere. It doesn't have to be just for survivors of trafficking. I mean, law enforcement, they don't even have safe people that they can go to, that what they're struggling with, because fear that it's going to affect their jobs, fear that they're going to be judged. And healthcare is no different, the healthcare providers. So we all need to be safe for each other. We all need that.
Yeah, I think I'm gonna say something. One, I agree. I believe, I always say, each and every one of us has a role to play and contribute in our own way. So it's not only one person, it takes a village, and that village including you and I. And again, my last mic drop is, now you had hear us, the panel today. Actions speak more than voice. So now go out there and be a hero. Thank you.
Thank you, Finest. Plant those seeds of compassion, plant those seeds of kindness.
There was a question that was dropped in the Q&A section that I just wanted to share and hopefully answer. But there was a question was, is there any way for patients to pass the practitioner a secret note of some sort of sign? And I think the idea that I wanted to share, which is this whole shift that I think it's our responsibility as healthcare providers. Christian shared, it's too hard to disclose. Like, that's not their job. Our job is to show love and compassion, and to ask that they'll share a note or a sign is hard. I mean, there's survival happening right now. So I would like to challenge us as providers to think about taking that trauma-informed stance of, it's our job to provide the care and the safety, and it's not a job for a patient to disclose anything. They just need to feel safe in order to start the healing process. And I'm encouraging us as providers to really take that on and really shift it away from the patient to disclose, and really take that on as us as the providers to provide that safe space so that healing can begin.
And lastly, stop asking us why we didn't run away. Don't ask us that question.
I don't have any other questions. I think we did our best to answer all the questions through the Q&A, and we also have appreciated so much that you have enjoyed this time with us, I hope. And we have put a couple resources in the chat. We've put a link to provide us some feedback to see how can we improve this evening. And we also, I think I saw there's a project called Project Echo, and there's some information in the chat about that. So if there's resources that you need, you're not in this work alone. Much like Gina said, that we are here to support each other, and it takes a village. So we're here to support you and do this work together and heal together. So we thank you all for joining us this evening, and hope you have a good rest of your week. It's Friday Junior, and so enjoy your weekend. Thank you, everyone, for joining us.
Take care, everyone.
Thank you, Stacy. Thank you, Nani. Thank you, everybody.
Thank you, everyone.
Thank you, Kate.
A pleasure to join you and to serve with you all.
It was our pleasure, Nani, and it was terrific working with you. And thank you all for all your input and for being on this call.
What a treat. We'll look forward to getting our link from Kate. Have a good night, everyone.